Food takes anywhere from 4 to 8 seconds. What has to happen to that food? Not necessarily broken down, but
peristalsis to move it.
Exactly. Peristalsis has to move. You got to massage it along, just like milking a cow. The circular muscles of the esophagus massage it down. The longitudinal muscles also milk the food down. So there's no mechanical or chemical digestion that occurs in the esophagus, but the reason it takes so long to get from the mouth to the stomach is the movement of those muscles in the muscularis externa layer has to literally milk that food along through peristalsis. Well, the pharynx actually has no role except for assisting us with swallowing food. There is no chemical digestion in the pharynx. There's no mechanical digestion in the pharynx. Same thing with the esophagus. There is no mechanical nor chemical digestion that occurs there. So what is the function of your esophagus? Transport food, that's all it's doing. It's taking food from your mouth and pharynx, bypassing your thoracic cavity, and then passing through your diaphragm so it can reach down into your abdominopelvic cavity. This should be a familiar picture from Bio 210. The lining of your esophagus, just like your mouth, is stratified squamous. It's also moistened with mucus, so it's a mucous membrane. So this type of lining is built for abrasion of food. So as the food passes down through your esophagus, it does actually carry away with it several layers of those cells. So that's why we have a thickness here from that stratified squamous. The cells in your esophagus, like your stomach, are replaced rather frequently. About every 2 weeks or so, new cells have to rise to the top and replace the old ones. So it's not that this is just a static environment. We're constantly having to replace these worn-out cells with new ones. We've seen a picture kind of like this before. This is a cross-section through the esophagus. Just wanted to show it to you so we could review those 4 layers. Starting with the deepest layer, what layer is inside for the food contact? Mucosa, good. And right here, of course, there's your stratified squamous. Come out superficial layer, what's next? Submucosa. What do you find in the submucosa layer? Sort of, like connective tissue. What else is there? Elastic fibers, good. What else? Blood vessels. Yeah. Stratified epithelium is in your mucosa layer, but submucosa, think more of a connective tissue. Think things like elastic fibers, autonomic nervous system, blood vessels. So submucosa, of course, is connecting mucosa to what next layer? Muscularis externa. Good. You'll notice here we've got 2 layers of muscularis externa. We've got a circular layer and we have a longitudinal layer. The outermost region is serous membrane. That's serosa, of course. So we've got 4 main layers that we find here on the digestive tract. Okay, here's a more clear picture of those 4 layers. I did want to mention to you, even though it's not on your worksheet, but there's a number of sphincters, which are rings of circular layers that are situated throughout your digestive tract. And it's not on your worksheet, but there is an upper esophageal sphincter. It's called the UES for short, and it's actually up here near the top of your esophagus. The reason that upper esophageal sphincter exists is to prevent you from swallowing air constantly down into your digestive system. As you probably know, the more air you swallow, the more gas you have. Either you'll belch that up or you pass it out the other end. So that little upper esophageal sphincter is a set of circular muscles that prevents the passage of air down into your esophagus. What prevents the passage of food into your respiratory system? Epiglottis. So we actually have 2 control mechanisms. One for the respiratory, one for the digestive, to prevent the wrong thing from passing into the wrong pipe. All right. Let's move it down a little further. We know the esophagus is lined with stratified squamous. stratified squamous is great for abrasion. Multiple layers there can be subjected to abrasion and not damage the underlying submucosal layer. Notice here, what an abrupt change. All of a sudden you're traveling from the esophagus. Notice this thick outermost stratified squamous now becomes a thin layer of simple, good columnar. So now you'll notice you're in the stomach. That is all the transition you need to know. It's not passing through the esophageal hiatus. It's not passing through the cardiac sphincter. The way you know that you've now traveled into the stomach, all you got to do is look at the tissue transition. You transition from stratified squamous in the esophagus directly to simple columnar in the stomach. Boom, you're in the next organ. That's all it takes. The neat thing about looking at the CAT is you actually can see this hiatus. The hiatus is an opening in your diaphragm where the esophagus should pass through. The hiatus does not necessarily mark the transition between esophagus and stomach. You can actually have a piece of your stomach that exists up in your thoracic cavity. If that is the case, we call it a hiatal hernia because a piece of your stomach has technically been herniated up through that opening. In that situation, you may have gastric juices and acids gurgling up here above your diaphragm. What organ is sitting right there?
Heart.
Your heart. And then, of course, on either side you've got the lungs. So if you've got gurgling, indigestion, and acid up here, what do people oftentimes think is happening?
Heart attack.
Heart attack. And you're right, it is acid reflux. So they oftentimes call it GERD for short, gastroesophageal reflux disease, and that can involve things like hiatal hernia and gastric juices gurgling back up into the esophagus. The problem here, going back to this picture, this stomach lining is simple columnar, but more than that, there's a thick layer of mucus that covers that simple columnar. What does that thick mucus prevent from happening? Acid erosion of the layers underneath. What do you think the esophagus is missing? That thick mucus. Yeah, so if you've got acid gurgling up here into your esophagus, even though stratified squamous is built for abrasion, it does not do well with acid pH around 0, 1, or 2 on the pH scale. That can actually digest away both the lining of the esophagus, pharynx, and mouth linings. That stomach acid can also gurgle up into your throat. It can give you, clearing your throat constantly. It can also give you problems with your teeth because teeth enamel can actually be eroded away by that stomach acid. So really the only organ built to handle that stomach acid is the stomach itself. Here's an internal view. If you were using one of those little scopes to travel down through an upper GI, you could pass through the hiatus here. You can see that they diagrammed a hiatal hernia. That's because they recognize this as being a piece of the stomach that is protruded up above the diaphragm. You can see a pinch over there for the diaphragm. I'm glad they labeled it. I wouldn't have thought anything of it, would you? It just looks like inside of the stomach lining here. But nonetheless, you can kind of see they've labeled some stuff from taking an upper GI into the esophagus. That takes us down to the stomach, which is our next organ. Up to this point, there has not been a whole lot of activity. Where is the only place so far that we have experienced mechanical or chemical digestion?
Mouth.
Mouth. What's the function of the esophagus? Transport food. And you'll notice that really we're not talking about any major digestive activity until we get here to the stomach. So, 4 to 8 seconds after you swallow the food, here we are, we're in the stomach. How long does food spend in the stomach?
4 hours.
About 4 hours, exactly. How long is it between meals? Approximately 4 to 6 hours, so that's how long the food will stay here in the stomach. Depending on how large the meal and how fatty the meal also influences how long that food will stay in the stomach. Of course, the larger the meal, the longer the food is going to be here digesting away, and the fattier